If you got the best healers in your community and you put them together and you ask them, what does it take for you to do your best work? That's the project that has become True North. Well, one of the policies that we decided on early on was to be a fee-for-service organization. We did not want to contract with insurance companies. A typical practitioner who is double booking every 15 minutes has got 7.5 minutes to spend with a patient. All they really have time to do is treat the symptoms. Not being an insurance-driven organization allows our practitioners to take as much time as they need to with their patients. It means I can sit down with a patient and say, tell me your story and give me the long version. We wanted to have access to people who couldn't pay cash up front. Our practitioners have agreed to do 10% of their care fee-free or for time credits. Our Exchange Portland is an organization in southern Maine where you can trade an hour of your time for an hour of someone else's time. And then they can take that time credit and spend it to buy healthcare at True North. Well, let me tell you about a patient of mine named Brooke. Brooke was a music teacher who was having problems with weight loss and fatigue and a terrible skin rash that had been treated with every known cream and drug that you can imagine. She wasn't making a lot of money teaching music and really didn't have a way to access healthcare of any type, and so a fee-for-service place like True North she didn't really think was an option for her. One of her students knew about True North and knew that we used our Exchange Portland. In fact, her students donated their time credits to her so that she could make her first appointment. When we saw Brooke, we were able to really go back and ask, when did this problem start and what was going on for the 6 months before that? With a change in diet and with improvement in immune system and gastrointestinal function, she's really been able to have a lot more energy for her work. So coming to True North was really a breakthrough for her at getting to the root of her problems. Had we had a series of 7.5-minute visits, we might never have gotten to the underlying causes that were driving the symptoms that brought her in. I'm Bethany Hays, and I've seen that innovations help us heal our patients.